confirmed its first case of monkeypox, Clade I, on Thursday, marking the first time this more serious variant of the disease has been detected outside Africa. Now, this news comes just one day after the WHO declared monkeypox a global public health emergency for the second time in 2 years. The infected individual had recently returned from a region in Africa experiencing a significant outbreak of the Clade I variant of Mpox, which spreads through close contact. The WHO's announcement followed an outbreak in the Democratic Republic of Congo, which has spread to neighboring countries. Sweden's Minister of Health and Social Affairs, Jakob Forssmed, announced during a press conference, and I quote, "This afternoon we received confirmation of a case of Clade I Mpox in Sweden, which is more severe variant of the disease." Their Wigzell, a health official, added that the individual had been provided with care and guidance according to health agency protocols. She stated this is the first diagnosed case of Clade I Mpox outside the African continent. The infection occurred during the person's stay in an area of Africa with a large outbreak of this variant. Now, let's also tell you what is Mpox. World Health Body, the WHO, on Wednesday classified Mpox as a global public health emergency. This comes after a surge in Mpox cases in the Democratic Republic of Congo, which is now spreading across parts of Central and East Africa. The highly contagious disease, which was earlier called monkeypox, had killed at least 450 people during an initial outbreak in the Democratic Republic of Congo. Mpox is a self-limiting viral infection, typically spread through close contact. While usually mild, it can be fatal in rare instances. Mpox is transmitted through close contact such as sex, skin-to-skin contact, and talking or breathing close to another person. It causes flu-like symptoms, skin rash of pus-filled lesions, and can be fatal, with 4 in 100 cases leading to deaths. The WHO's declaration of a public health emergency of international concern is its highest level of alert. Outbreaks can be controlled by preventing infections with the vaccines, though these are usually only available for people at risk or those who have been in close contact with infected person. At least 99,176 cases and 208 deaths due to monkeypox have been reported from 116 countries since 2022. Now, this is as per the WHO data. Currently, scientists are concerned about how fast a new variant of the disease is spreading and its high fatality rate. The risk assessment of virus spreading mostly in children through multiple modes of transmission has also been considered to be high. As for India, while no case has been reported so far, the risk continues owing to travel. At least 27 laboratory confirmed cases and 1 death due to monkeypox has been reported from India since 2022. This is as per the WHO data. India has reported 4 cases of monkeypox so far, 3 in Kerala and 1 in the capital Delhi. The initial cases in 2022 were reported from Kerala, where the patients had a history of international travel, and 1 other from Delhi, where the patient did not. That's why we urge all our viewers to be more vigilant.
Vi har också nu under eftermiddagen fått bekräftat att vi har ett fall i Sverige av den allvarligare typen av Mpox, den som heter Clade I. Det är förstås någonting vi tar på allvar. Samtidigt är det här ett arbete som hälso- och sjukvården och de regionala smittskyddsenheterna kan och har upparbetade rutiner och system för att hantera. Den tillförordnade generaldirektören Olivia Wigzell för en närmare redogörelse för läget. Folkhälsomyndigheten samordnar arbetet på nationell nivå och har nära dialog med de regionala smittskyddsenheterna.
Vi har en person som har sökt vård i Region Stockholm som har konstaterats ha Mpox orsakad av, som vi hörde, virusvarianten Clade I. Och fallet är det första som är orsakat av Clade I som har diagnostiserats utanför den afrikanska kontinenten. Den drabbade personen har också smittats under en vistelse i ett område i Afrika där det pågår ett stort utbrott också av Mpox, Clade I. Men titta på analyser, vad är det för resandeströmmar det handlar om? Och personen i Sverige som har bekräftats då vara smittad har fått både vård och förhållningsregler enligt gällande rekommendationer. Och vi bedömer att Sverige har en bra beredskap för att både diagnostisera, isolera och vårda personer med Mpox på ett säkert och bra sätt.
Alla 3 kommer finnas kvar för enskilda intervjuer.
Let's go across to Dr. Ishwar Gilada, who is an infectious diseases expert. Very warm welcome to you, sir. I want to understand from you, I will start with the basics. What is monkeypox and how does it spread?
See, now renamed as Mpox. Monkeypox has been orthopox family virus, from where we got smallpox, variola, which was used to make smallpox vaccine. There are other pox diseases called cowpox, squirrel pox, rat pox, horse pox, Alaska pox. So there are a lot of diseases which have a pox. This is one of the zoonotic diseases. Zoonotic means originally originating from animal, usually spread in animal to animal, but sometimes accidentally spread from animal to human being. Now, if it is limited to animal to human being, but not among human being, then it would have been a limited pandemic or epidemic or problem. But this is also now spreading from human to human. It is mainly spread through intimate sexual contacts. And whatever number of cases we have seen globally, 99% of the cases are in men having sex with men. So, and this is giving rise problem to fever, muscle ache, body ache, and thereafter some pox marks. Pox mark means some kind of outburst or a boil kind of thing, which happen usually sometime on the cheek, on the hand, foot, and then genital area, perianal area. And then sometimes the lymph node are enlarged, and sometimes there are systemic infections where there is a respiratory system involvement. And almost 0 to 10% death rate is recorded. This Clade I, which has originated from DRC Congo, Democratic Republic of Congo. First human case was diagnosed in the 1970. And before that, it was there, but it was in monkeys, and that was 1958-59 time. Thereafter, it remained endemic to only that country, DRC Congo. And then Clade II, which was in the Western Africa, which was there are countries like Nigeria or Senegal, Gambia. Those countries had Clade II virus. Clade II was more infectious than Clade I. So the previous outbreak which happened, and that time it was also declared a emergency in July 2022, and that time it was spread from Clade II to all over the world, and close to 90,000 cases were diagnosed till then, and thereafter by May 2023 the infection started going down, and therefore the WHO lifted that emergency tag to this virus infection. Now they again reimpose, and this time it is Clade I, and Clade I there is a and B. B is now spreading more often because Clade A was not spreading often. So it has gone to the 4 neighboring countries which were unaffected by Mpox or monkeypox earlier. And they are Kenya, Rwanda, Burundi, and Uganda. And there are other 11 countries in Africa where it is there. Now we are worried about the infection going out of Africa to other places. You have seen one case from Sweden. You have seen another case from Pakistan. And if you look at the total trajectory, almost 61% cases were from Africa, 20% or 21% cases from the America, and 11% cases from Western Europe. So there are 2 or 3 very important things. Number one, this is a sexually transmitted infection. I had described almost 2 years before that this is the 21st STD in 21st century. So we had other 20 STIs, and now it is added to one more. Number 2, it is mainly in men to men. Number 3, those which are vaccinated against smallpox, in smallpox vaccination stopped around the 1987-88 in India or many other countries in the world. So those people which are born before that and vaccinated against smallpox, they are immune. So if we calculate that kind of age, then people which are above 44 or 45 years of age, they are not getting monkeypox. So it is between 44 and 20. So that kind of age group. And thirdly, hardly few cases are noted in women, though theoretically it is described among children. We have seen only couple of cases in children. So if you talk total scenario, 99% cases are in men, and that is mainly men having sex with men. Now the issue is arising is that in the HIV awareness, we talk about pre-exposure prophylaxis, post-exposure prophylaxis for preventing HIV. But when we talk about pre and post exposure prophylaxis, we do not talk about other STIs which are also transmissible and sometimes highly transmissible than HIV. And therefore, what is happening? There are two kind of people. Those which are having a background of working in STIs, they will tell people that using pre-exposure prophylaxis, that is medicine, or post-exposure prophylaxis as a medicine, is in addition to using condom. It is not replacement of condom. Condom will prevent other 19 or 20 infections. In addition to that, HIV will be prevented by PrEP or PEP. But those kind of heavy awareness campaigns, which are around 2000, 2010, they are died down. And those children which are born during that time, they were not exposed to high profile campaign like this. And now they are grown up. They are 20, 25 years of age. And they are indulging in indiscriminate sexual activity without understanding that they are at exposure of any other STIs. One of them is Mpox, but there is syphilis, there is HPV, there is herpes, there is gonorrhea, chlamydia, which are having resurgence. So in last 10 years, we started seeing resurgence of STIs. Earlier, because of HIV awareness campaign and high condom usage, all STIs went down. Those doctors who were practicing STIs, they didn't know what to do because there was no STI cases there. In last 10 years, it started going up again. So we need to understand that is one thing, and most important thing is almost 60%, 70% new infections all over the world in last 30, 40 years are viral infections. And most of them are zoonotic infections. Zoonotic means arising out of animals. So when they arise out of animal, we have seen Nipah, Zika, Ebola, HIV, now the Mpox, cowpox disease, mad cow disease. So all these infections or SARS or avian influenza, these are all coming from either animals or birds. So what is happening? That human beings, for their own survival and for their own interest and for their own benefit, they try to intrude the atmosphere of other animals, forest, other birds. And that's the reason that if we want to survive, we have to let them also survive. It's a symbiotic relationship. But if we try to intrude that atmosphere, we pick up their infections and then it will be transferred from human being to human being, and that is a big problem. So we are in trouble because of two things. One is, on one hand, there is ecological imbalance, and we see a lot of problems happening with ecological imbalance. Again, there also human beings are intruding forest and other ecological places where human beings should not be in big number. And number two, these are zoonotic diseases where we are going in forest rather than only eating domestic animal. People are eating wild animal. They are hunting for wild animal, and then you pick up infection. So infection can be picked up through animal, and then it is limited to that particular transmission. That was okay. But when it is starting transmission from human to human, that is more dangerous. So currently H5N1, which is avian influenza, we have not seen human to human transmission. It has come from only either cows or domestic animal to human being. But Mpox is human to human. So now we just forget how it has originated from monkey, how it has come to human being. But now it is not through monkeys, it is through squirrels or through rats or dormice.
Right.
And it is from there to human being, but human being to human being spread is happening in a quite a good number.
All right. Thank you very much, Dr. Gilada, for joining us with all of those important insights. There's, of course, a lot more that I wanted to ask you, but unfortunately, we're short on time. Thank you very much for sharing your insights.